This is Amy Ritter, Scientific Editor with Biopharm International, and I'm speaking today with Guenter Strategic Customer Relations Lead at GE Healthcare. Thank you for speaking with us today.
You're most welcome. It's my pleasure.
So obviously the EU has had biosimilars both in development and on the market for a number of years, but the U.S. has only recently put their guidelines in place. How do you see the U.S. market developing? Do you see any differences between U.S. and Europe?
Yeah, if you look at, the history in Europe, it started in 2005, and then a number of years after that, we got regulations for specific types of molecules specifying the general documents. 14 such biosimilars have been approved. I think 12 of them are actively marketed. I take the European history as an indicator that it will also move relatively slowly in the U.S., even once the floodgates, so to speak, are being opened and the regulation is actively being used. There's no requirement for clinical trials in the U.S., but this totality of the evidence approach that the FDA is describing for this tells me that it is very likely that there will be demands on clinical trials. So that alone means that it will take time, will cost a lot of money. Not everyone has deep pockets who wants to launch biosimilars. And so many people, I think, may have to rewrite their business plans a little bit too. And so we will see the U.S. market with biosimilars, but I don't really foresee that it will be much faster.
Can you clarify why nothing has been approved in Europe over the past 3 years? Nothing new?
Well, I don't think I have all the explanations for it. It's just an observation. It's a fact, right? It hasn't happened. And so essentially one could argue that this is because we have now a number of biosimilar molecules in the European markets for EPO, for the biosimilars to Neupogen, the filgrastim biosimilars, and then also growth hormone. And with those biosimilars in the market competing for price and market access, it may just not be so attractive for anyone else to go for the same target molecules again and go for the same markets. The business case may just not hold.
So you've mentioned certainly the large pharmaceutical companies as bringing up their own biosimilars development project as being big players, but certainly the Asian countries have their own biosimilars development programs that I guess my understanding is that they are their regulations are not harmonized either with EU or with the pending U.S. regulations. Can you comment on how you see developers in Asia affecting the world market?
Yeah. Two comments maybe. First of all, it's a little bit of a terminology comment. Biosimilars, in the way I would like to use it, is strictly limited to molecules that have been approved or are aimed for approval, targeted for approval under a biosimilar regulation, specific biosimilar regulation. And that limits it currently to things that have been approved in Europe, in Canada, in Australia, and Japan, countries who have specific biosimilar regulations, and more recently in Korea as well, South Korea. Molecules in India, for example, or in China, which are also copies of originator molecules, are just copies, but I would call them non-biosimilar copies or non-originator copies or whatever you want to say there. There's a bit of a debate about what the best terminology is. They are often not approvable under the biosimilar regulations because they have never faced comparison with any reference product. The concept of reference product is not used or was not used in India or China for any of the molecules that are currently on the market there. And so just for that simple reason, they wouldn't be approvable anytime soon in Europe or in the US. That is probably going to change also, and while rules are sharpening up in India and China, eventually also the players there, the local players there, will become more competitive because they're more getting used to harder regulations.
Right. Well, thank you very much for speaking with us today.
Most welcome.